Hello guys, Dr. Qureshi here. Today we are going to talk about retinoblastoma. We have a kid here. How old are you? 11. And this is his mom right there. And they have given their consent for this video. So I saw him in the past in another clinic where I was working, and today they are here as a follow-up, right? It has been almost a year. Retinoblastoma is a tumor and cancer of the retina in the eye. So when you look at this eye, if you can come closer and focus here. In the past, I'm going to put a pen light in there. When he did have the tumor cancer, which is a retinoblastoma, you could see the reflex in the eye. If you look here in the camera, you could see it, but now you can't see it because it's gone now, right? So you can see a little white opacification in the pupil, like right there in the center of the eye. Like if this is the pupil right there, you see that? It will be in this area. You can see the whiteness, even with like a naked eye. And that condition is known as leukocoria. So he had that, and how old was he when he had that?
2.
He was 2 years old. And how old is he now?
11.
11. So the mom actually, we diagnosed it at some point, obviously, and then she took him to St. Jude's hospital. Okay. Now, do you want to tell what happened afterwards from there?
When he was 2, I noticed he turned his head and he had like a weird film over his right eye.
Mm-hmm.
I had previously read a story about a little girl who had the retinoblastoma.
Mm-hmm.
So that caused for concern.
Right.
So I actually took him to his pediatrician, and they did the red reflex light.
Correct.
And they were able to see the red reflex.
Mm-hmm.
Then we took him to an eye doctor. They had diagnosed him with pink eye, which wasn't the case.
Correct.
So we searched through eye doctors and we switched because I had a motherly instinct that
Something was
wrong.
Yes,
I knew
yes.
something was wrong.
Mm-hmm.
So we switched him to a different eye clinic, had an early morning appointment, and explained what was going on. They did the nurse came in and checked him.
Mm-hmm.
She even knew that something was wrong when she checked him. Doctor came in, and eventually they confirmed he did have the retinoblastoma. They also went ahead and scheduled him with St. Jude the very same day.
Mm-hmm.
So we left the clinic, packed up our things, and we headed to Memphis.
Correct.
Where he began.
This is where St. Jude's Hospital is, yes.
He began treatment right away.
Good. Now let me just say a few things, because she has very good points. So and then we can continue that part, because she made some good points. Like when you look at the eye, some doctors were just not misdiagnosing. I mean, they were thinking it's a red eye. Yes, the patients can have red eyes during that process. They can even have pain in their eyes. Their vision starts getting worse, and then the eye can also have an eye turn. So in the past, I noticed his eye used to turn out a little bit, which is exotropia, and today it's not that prominent. Ever since he had the radiation therapy, and how many rounds of radiation did he have?
He did 1 round. It was a 4-day radiation plaque that they implanted.
Got it. And before that, he had
11 rounds of chemotherapy.
Okay, so
injected directly into his
eye. So he's doing really good. After 11 and then radiation therapy, chemo and radiation, his vision, last time I remember when I saw him at the other clinic, he was 20/70, and I think he's going to be a little bit better now, because we haven't done the whole refraction today, but his eyes look a lot better. And then he had cataract surgery also in the process, and after the removal of the cataract, it looks a lot clearer. So when I checked his retina today, it looked good. Now she talked about the red reflex. That's important, because this is the instrument, this is the ophthalmoscope with which we can see the red reflex. She had a good point, because she said that sometimes, yes, when you look at the eye, you see the red reflex. You're not seeing the white leukocoria, the opacification of the white area in the pupil, because his retinoblastoma was not in the optic nerve area. It was not central. It was a little bit below the optic nerve. So we have to be careful with that part. You made a good point. Okay, anything else? And after that, we'll talk about the gene markers also. Okay.
He's done really well since the cataract surgery and the radiation. He's had no growth come back.
Good.
He plays soccer, he plays baseball, ready to start football. He really never let it slow him down. We've had some tough days going
Yes.
through treatment, but he's at a much better place. You know, we make
Yes.
sure we keep our appointments because it's important.
Exactly.
Any blastoma cancer can spread quickly.
Correct. It's
So
a
you
cancer.
always want to stay ahead of it and make sure that
Exactly.
it's stable.
Yes, and so she's good because she's going for follow-up appointments at St. Jude's. She's doing every 6 months here. She's going to do every 6 months also. Now, a little bit about the retinoblastoma gene markers, RB1. So we do that. Some of the testing that can be done before we even start treatment is MRI, and then the very diagnostic one is an ultrasound of the eye. So that's very important, and obviously he got everything done. So that's the case for retinoblastoma. Read about it. Thank you, both
You're
of you, and we'll see them back. Thank you.